All right, let's think about something for a second. Imagine you had a single tool in your toolbox that could fix both a leaky faucet and also disarm a bomb. That's kind of what we're talking about today in the world of medicine. We're diving deep into levofloxacin, and we're going to look at it not just as another pill, but as an incredibly powerful tool that demands a ton of skill and respect to use correctly.
I mean, just think about that question. What else out there can bridge that gap? From something as common as a sinus infection that just won't go away, all the way to a potential bioterror threat like anthrax. It's a pretty wild spectrum, right? And the answer, levofloxacin, is exactly why we're here. That unbelievable range is what we're going to unpack.
So here's the game plan. First, we'll get a handle on what this antibiotic actually is. Then, we'll survey the bacterial battleground to see what it's up against. After that, we're going to shrink down and go right inside the bacterial cell to see how it works its magic. From there, we'll check out the dosing blueprint, cover the really critical safety warnings, and finally, we'll zoom out to see the bigger picture.
Okay, let's jump right in. What is levofloxacin? What makes it one of the most effective fighters that doctors can call on when things get serious? It's part of a special class of antibiotics called the fluoroquinolones. Now, you don't need to remember that name. Just think of them as the special forces of the antibiotic world. They're not the cops on the beat for every little thing. They're the highly trained unit you call in to stop a severe infection dead in its tracks.
So, what kind of battles are we talking about? Where is this elite unit deployed? The range of infections it's designed to defeat is actually pretty mind-blowing.
On one side of the battlefield, you've got these tough, common infections. We're talking about serious community-acquired pneumonia, a nasty case of bronchitis, or a sinus infection that just laughs at other treatments. It's also a go-to for complicated UTIs and skin infections. For these jobs, it's an absolute powerhouse. But this is where the story gets really wild. Levofloxacin is also a frontline defense against some of the scariest things imaginable. It is a primary treatment for plague and for anthrax exposure. This isn't just theoretical, it's why governments around the world stockpile this very drug. It's a crucial piece of our defense against bioterrorism. So how in the world does it do that? How can one drug be so good at fighting such different enemies? Well, to figure that out, we have to go microscopic. We're heading inside the bacterial cell to see its brilliant and, frankly, brutal method of attack. See, inside every bacterium, there are these two critical enzymes, DNA gyrase and topoisomerase 4. You can think of them as tiny little mechanics whose only job is to unwind and rewind the bacteria's DNA. This process is absolutely essential for the bacteria to copy itself, to make repairs, and just to live. Without these two, the whole operation just shuts down.
And this is where levofloxacin is so clever. It gets inside the cell, finds those two little mechanics, and completely gums up their works. It blocks them. The DNA gets stuck. It can't be copied. It can't be repaired. The bacteria is basically paralyzed. It can't multiply, and the infection grinds to a halt, letting your own immune system mop up the rest. It's a precision strike right at the heart of the enemy.
Okay, so we know how it works, but like any powerful tool, you gotta know how to use it. The dose, the duration, it all changes depending on what you're fighting. Just look at the range on this chart. For a straightforward UTI, you might just be on it for 3 days. 3 days. But for post-exposure to anthrax, we're talking 60 days. That's 2 full months. This really shows you how doctors have to carefully calibrate the use of this tool based on the specific threat.
Now, it comes in a few forms, but here's something that's a really big deal. That last note, oral bioavailability is nearly 100%. In plain English, that means when you take it as a pill, your body absorbs almost all of it. It's nearly as effective as getting it through an IV drip in the hospital. This is huge because it means really sick people can often go home and continue a very powerful treatment just by taking a tablet.
So far, it's all sounded pretty amazing, right? But here's the turn. With a tool this powerful, you have to be incredibly cautious. We absolutely have to talk about the risks, because they are serious. Levofloxacin and all fluoroquinolones come with something called a black box warning from the FDA. Let that sink in for a moment. This is the most serious warning the FDA can put on a drug. It's reserved for medications with risks of severe, sometimes even life-threatening side effects. And these are not small risks. We're talking about disabling and potentially permanent problems. This includes things like tendinitis, which can lead to a full-on tendon rupture, like your Achilles tendon just snapping. It can cause serious nerve damage in your hands and feet, and even central nervous system effects like seizures. This is not to be taken lightly.
And what's really important to understand is that the risk isn't the same for everyone. For older patients, the risk of tendon rupture and even heart rhythm problems goes up. If you're also taking a steroid like prednisone at the same time, that risk of rupture shoots way, way up. And this is why it's almost never given to kids. The risk of damaging growing muscles and tendons is just considered too high.
It's also not just about who you are. It's about what else you're taking. Even something as simple as an antacid or iron or calcium supplements can block the drug from being absorbed properly. You have to space them out. If you take it with a blood thinner like warfarin, your bleeding risk can go up. This is why it's so critical that your doctor and pharmacist know every single thing you take, down to the last vitamin.
Okay, let's pull back for our final section and look at the bigger picture. We have this incredible, life-saving tool, so the biggest question of all becomes, how do we use it responsibly? How do we make sure it's still here for our kids and their kids?
And this is the central challenge with all of our best antibiotics. They are lifesavers, but every single time we use one, we give bacteria a chance to learn and evolve ways to defeat it. Using a powerful drug like this for a simple cold, that's like using a cannon to kill a fly. It's not just overkill, it's training all the other flies how to become cannon-proof. And that's antibiotic resistance. This isn't just an idea. It's the urgent warning from the entire global medical community. Judicious use, that's the key phrase. It means being thoughtful, being careful. It means saving our most powerful tools for the fights that truly need them, not wasting them on battles we could win another way. So we're left with this incredible balancing act. On one hand, we have a tool that saves lives from pneumonia, from the plague, from anthrax. On the other hand, its very power is a resource that we can deplete through overuse. So the question for all of us is, how do we balance the urgent needs of the patient right in front of us today with the need to protect these miracle drugs for all the patients of tomorrow? It's a huge challenge and a shared responsibility. Thanks so much for joining me today.